Hi, Dr. Hagmeyer here, and in this short video, I really just wanted to share a possible explanation as to really why you feel worse after taking supplemental progesterone. Maybe you're a woman who was seeing a bioidentical hormone specialist, and initially when you started taking these hormones, you really felt quite a bit better. And after a couple months, you've started to notice that you started to feel lousy again, and maybe even worse than you did before you began working with this particular doctor or specialist. Maybe you're a woman who was experiencing PMS or perimenopausal symptoms, and you went to a doctor and the doctor really looked at your symptoms, and he or she, without even really doing any kind of testing with you, just gave you a prescription for hormones. And so you began taking these hormones, and again, you felt better initially, but again, now you feel lousy, okay? Perhaps you're a woman who, after even being tested, you showed up as having low progesterone, and so you were prescribed progesterone. You began taking it, and initially, again, you felt good, and now again, you feel lousy or you feel even worse than you did. So what's the deal? Why is this happening? Okay, well, if any of those three scenarios really has happened to you and it really sounds familiar to you, you're going to really want to pay very, very close attention to what I'm about to say, okay? I want to say for the record that I'm not a big fan of using creams, okay, or hormones in a woman who actually has a menstrual cycle. I'm not saying that I don't ever prescribe them. I'm not saying that they can't be useful. But what I am saying is that you really need to be extremely careful. You need to be cautious anytime you begin taking hormones, and I would never, ever, ever follow some cookbook recipe on hormone dosages that you find at the end of a book or that you read on the internet. Okay, so that's my disclosure, that's my warning for obviously this video. All too often, it's very easy to see on testing that a woman has low progesterone, and so the assumption is made that if someone is low in this particular hormone or that particular hormone, well, then it stands to reason that they could really just benefit from what they're lacking, right? That seems pretty logical, makes sense. It's straightforward, but unfortunately, that's really not how your body works. Okay, what's going on inside your body is much more complex. It's more than just a deficiency. And when you're dealing with hormones, you really need to understand that there are many, many different things that influence your hormones. And before you ever begin taking hormones, you need to have those hormones properly assessed with the right kinds of testing, and you need to have them retested within a minimum of 90 days, okay? So there's no doubt that bioidentical hormone therapy has really become a widely adopted, it's a very useful method of increasing hormone levels. And while it is much safer than using synthetic hormones or animal-based hormones like Premarin, there is no doubt that bioidentical hormone therapy has its dangers, and the purpose of today's video is really to highlight why progesterone creams can often make you feel worse. Okay, so when I first began practice back in 2000, I saw many, many women come into our office who experienced hormonal problems. Many of them were already, coming in, being on progesterone creams and dermal creams, and many of them had been to compounding pharmacies, and many were coming into my office just in tears and really on the brink of a breakdown. And so what we're describing here are the creams that you will really apply and rotate to different parts of your body. And it wasn't long that after I saw this frustration, I myself became very frustrated of what I just continued to see over and over and over again to many of these women who would come into our practice. And I noticed that these creams, typically worked wonderfully in the very, very beginning, and then invariably they stopped working, and many women would exhibit signs of hormone deficiency or experience something known as dermal fatigue. What happens not only for progesterone cream, but for really any other hormone preparation you use by applying this cream to your skin, is that within a few weeks to a few months, what you're going to begin to do is you're going to begin to saturate those tissues, those fat tissues. And all in the meantime, the hormones are going to actually be building up in your body, and they're going to actually stop working. Now, the problem relates here to the fact that progesterone is very highly fat soluble. And once it's applied to your skin, it's going to store itself in those fat tissues. And when a woman initially starts using this cream, the fat stores are very, very low. And this is why initially there's such an improvement, very drastically. But unfortunately, as time goes on, that cream will quickly accumulate and contribute to disruptions in the adrenal hormone steroid pathway, affecting things like DHEA, cortisol, and testosterone. So again, as beneficial as progesterone cream can be, it must be monitored very, very carefully. Okay, so my best recommendation here is that you work with a doctor who really exercises caution with these hormones, but also evaluates the entire hormone family and just the possibility of these hormones being converted into downstream hormones that could potentially put your health in a lot of jeopardy. I'm Dr. Hagmeyer. I hope you enjoyed today's video on progesterone. And for more information on hormones and really how we work with patients, I want you to visit our website at www.drhagmeyer.com. Okay? Take care.